1. Which hormone is primarily responsible for milk ejection during breastfeeding? A. Progesterone. B. Prolactin. C. Oxytocin. D. Estrogen. 2. Which of the following is considered the most reliable indicator of adequate milk intake in a healthy term infant? A. Number of minutes spent at the breast. B. Frequency of feedings per day. C. Infant weight gain pattern. D. Number of times the infant cries. 3. A mother presents with breast pain and fever. On examination, her breast is tender, red, and swollen. What is the most likely diagnosis? A. Blocked duct. B. Mastitis. C. Engorgement. D. Candidiasis. 4. Which maternal medication is contraindicated during breastfeeding? A. Ibuprofen. B. Methotrexate. C. Acetaminophen. D. Amoxicillin. 5. Which position is most beneficial for a mother with oversupply and fast letdown reflex? Side lying. E. Cross cradle. C. Cradle hold. D. Laid back position. 6. Which of the following is the strongest determinant of successful long-term breastfeeding? A. Maternal education level. E. Early initiation of breastfeeding within 1 hour of birth. C. Use of breastfeeding pillows. D. Number of prenatal visits. 7. Which nutrient is generally recommended as a supplement for exclusively breastfed infants starting at 4 months of age? A. Vitamin A. B. Vitamin D. C. Vitamin K. D. Vitamin E. 8. Which latch sign indicates effective milk transfer? A. Smacking noises during feeding. B. Lips flanged outward. C. Dimpling of cheeks. D. Shallow latch only on nipple. 9. Which condition is a contraindication to breastfeeding? A. Maternal tuberculosis under treatment with standard medications. B. Maternal use of methadone maintenance therapy. C. Infant galactosemia. O. Maternal hepatitis C infection. 10. The primary role of the IBCLC is to A. Provide formula feeding instruction when requested. B. Promote and support breastfeeding through clinical management and education. C. Replace pediatricians in infant nutritional care. D. Serve as a hospital administrator for perinatal services. 11. The most appropriate intervention for a mother with recurrent blocked ducts is A. Apply ice before feeds. B. Use tight-fitting bras for support. C. Frequent effective breastfeeding and complete drainage. D. Limit fluid intake to reduce milk volume. 12. Which maternal factor most commonly delays lactogenesis 2? A. Vaginal delivery. B. Early skin-to-skin contact. C. Retained placental fragments. D. Exclusive breastfeeding. 13. In a preterm infant, which feeding method best supports the transition to exclusive breastfeeding? A. Bottle feeding with formula. B. Gavage feeding until term age. C. Cup feeding with expressed breast milk. D. Pacifier used to develop sucking reflex. 14. Which oral abnormality is most associated with breastfeeding difficulty? A. High arch palate. B. First erupted tooth. C. Epstein pearls. D. Macroglossia. 15. Which WHO recommendation supports exclusive breastfeeding? A. Exclusive breastfeeding until 4 months. B. Exclusive breastfeeding until 6 months. C. Introduction of solids at 2 months. D. Exclusive breastfeeding until 9 months. 16. Which is the best management for a mother with nipple candidiasis? A. Warm compresses before feeding. B. Oral antifungal treatment for mother and infant. C. Antibiotic therapy for both mother and infant. D. Application of lanolin after each feeding. 17. Which is the most appropriate first-line treatment for mastitis in a breastfeeding woman? A. Abrupt weaning. B. Antibiotics and continued breastfeeding. C. Exclusive pumping. D. Cold compresses and breastfeeding cessation. 18. The baby-friendly hospital initiative's 10 steps primarily aim to A. Increase hospital profits. E. Support optimal breastfeeding practices. C. Provide more formula samples. D. Reduce birth interventions. 19. What is the main function of secretory IgA in breast milk? A. Provide calories for growth. B. Promote digestion of lactose. C. Protect against gastrointestinal infections. D. Stimulate milk production. 20. What is the typical frequency of feedings for a healthy term newborn in the first month? A. 3 to 4 times per day. B. 5 to 6 times per day. C. 8 to 12 times per day. D. 1 to 2 times per day. 21. Which of the following may suggest ankyloglossia, tongue tie, in an infant? Excessive stooling. B. Clicking sounds while feeding. C. Persistent hiccups after feeding. D. Early tooth eruption. 22. Which factor has been shown to enhance oxytocin release during breastfeeding? A. Watching television during feeding. B. Maternal stress. C. Skin-to-skin contact. D. Infant swaddling during feeds. 23. Which is the most accurate description of colostrum? A. High in fat and low in protein. E. Rich in immunological components and proteins. C. Similar in composition to mature milk. D. Always produced after 2 weeks postpartum. 24. What is the recommended duration for exclusive breastfeeding according to the American Academy of Pediatrics? A. 3 months. B. 6 months. C. 9 months. D. 12 months. 25. Which intervention is most appropriate for engorgement? A. Apply cold compress after feeding. B. Restrict breastfeeding to every 6 hours. C. Stop breastfeeding temporarily. D. Use nipple shields continuously. 26. Which condition may require supplementation despite exclusive breastfeeding? A. Infant with jaundice due to ABO incompatibility. B. Infant with delayed passage of meconium. C. Infant with congenital heart disease and poor weight gain. D. Infant with frequent urination. 27. Which maternal behavior most supports continued lactation? A. Scheduled feeding every 6 hours. B. On-demand feeding and frequent emptying. C. Limiting night feeds. D. Exclusive pumping without direct breastfeeding. 28. What is the most common cause of sore nipples in breastfeeding mothers? A. Candidiasis. B. Poor latch. C. Excessive milk supply. D. Use of nipple creams. 29. Which benefit of breastfeeding is most significant for preterm infants? A. Lower risk of obesity later in life. B. Decreased risk of necrotizing enterocolitis. C. Faster transition to solid foods. D. Improved tolerance of formula. 30. Which breastfeeding position is best recommended for mothers who had a cesarean section? A. Cross cradle. B. Football hold. C. Upright straddle. D. Side lying with infant on abdomen. 31. Which situation requires an IBCLC referral? A. Infant refuses bottle. B. Persistent maternal nipple pain despite corrected latch. C. Infant sleeping 3 to 4 hours between feeds. D. Mother requests vitamin supplements. 32. Which growth chart should be used for breastfed infants under 2 years? A. CDC growth chart. B. WHO growth chart. C. Local hospital chart. D. National Center for Health Statistics chart. 33. Which fatty acid in breast milk is critical for infant brain development? A. Palmitic acid. B. Oleic acid. C. Docosahexaenoic acid, DHA. D. Linoleic acid. 34. Which factor most strongly influences milk composition? A. Maternal age. B. Stage of lactation. C. Maternal diet exclusively. D. Infant's gender. 35. Which test is most reliable to assess adequate intake in a breastfeeding infant? A test weighing pre- and post-feed weights. B. Observation of infant behavior alone. C. Maternal breast fullness. D. Stool color only. 36. What is the most likely consequence of early pacifier introduction in the first week? A. Improved weight gain. B. Nipple confusion and reduced breastfeeding. C. Increased milk supply. D. Improved latch technique. 37. Which maternal health condition is most associated with reduced milk supply? A. Hypothyroidism. B. Hypertension. C. Diabetes mellitus type 2. D. Asthma.